with that, I'd like to pass this off to our Speaker Joe Sacacci. Joe, thank you so much for being here, and thank you for your leadership over the last session.
Thank you, Governor. Thank you, Governor. Thank you all for being here today. Not the best weather day, but nevertheless a very beautiful day for a lot of people, and very important day. The Governor talked about it in his statement, but these bills will save lives. These bills will save lives because we are looking at ways, different, innovative, creative ways to tackle the opiate problem. Whether it's treatments with telemed, whether it's penalties for those who abuse the prescription process, whether it's treatment or decriminalization of other types of drugs that help with overdose prevention and treatment, these bills are tackled. And it's not easy. They're not popular. I remember passing, after many, many years and hearing debate about treatment centers, after passing it, became an issue on some of the local media that were against it, on TV shows, radio shows. You're going to have a harm reduction center, and I'm like, yes, we are. We're going to have one or possibly two in the state because we need it. These issues touch everybody, everywhere, from East Greenwich to Providence, from Barrington to Woonsocket, from Westerly to Warwick. Nobody is immune. No economic class of individuals, no geographic area, no one that you know or in your family or in your friends or your neighborhood hasn't suffered a loss because of this. So we work hard and we work honorably here. And I know that's not popular recently, but we work very hard in the General Assembly, and I'm proud to work with my colleagues, and I want to recognize them. I want to thank the Governor, Lieutenant Governor, the Mayor of Central Falls is here. I particularly want to recognize, obviously, Senator Miller, who's championed this in the Senate for many years, my good friend and floor manager, Jay Edwards, Senior Deputy Majority Leader, Deb Falella, our Health and Human Services Chair, Stephen Casey, who shepherded through telemedicine, which allows people to get counseling when they're not able to show up in person, be it a pandemic or logistical problems. I want to recognize two representatives from the House who worked hard on these issues and continue to work hard for their communities and for the state. Representative Josh Giraldo, who's here, Representative Ed Cardillo, and I recognize Mayor Rivera earlier from Central Falls also. These are important issues. The Harm Reduction Center will save lives. It would allow people to feel safe, to get treatment, to get education, get tested, to get prevention. The decriminalization of buprenorphine, and I'm sure I mispronounced it, is another tool for our first responders to have when they meet somebody, come into contact with somebody who has an overdose. Creating penalties and fines and putting it under the jurisdiction of the Department of Health for physicians and prescribing entities who abuse or neglect the proper protocols when prescribing opiates. Makes people think twice before that. I recently had some surgery. I was given an opiate, very painful. I used it up in 3 days. It was a week's supply. I called the doctor. I said, more? He said, no. He said, take ibuprofen. So we need to, and it worked. It took a lot of them, but it worked. And ultimately, we need to educate everybody up and down that prescription, treatment, protocol to make sure that we follow the way to do it. And finally, the telemedicine coverage, which I talked about latest. We have a new chairman dedicated. All of these bills went through Chairman Casey's committee. He's attacked this new committee in the House with passion and color, in his advocacy, and in his wardrobe sometimes. But nevertheless, he does a phenomenal job, and we're lucky to have him. And he brings the first responder from his job as a Woonsocket fireman to the table every time, and he comes into contact with people who have overdosed. And he brought a perspective that was so needed. It was not easy to pass harm reduction. People have long-standing fears about it. Stephen boiled it down to what it means to save a human life. and that makes all the difference. I want to thank the governor and everybody for being here. I want to next turn over the podium to my good friend, Senator Josh Miller from the fine city of Cranston. Senator Miller. Thank you.
So, I've been a state senator since 2007 now. And this is one of the most important days for me since I've been a state senator. And it took some of the hardest work I've ever been involved in to get here on these bills. Because we're talking about saving lives, as the speaker said. And we have 4 very important bills, all of which not only myself, but my committee, who worked incredibly hard on this, my leadership, who supported me throughout the years that this legislation has been in front of us, and my staff. I see some of my staff here, and the policy staff. They've all worked incredibly hard around this issue. And the reps who were involved, Rep. Edwards, Chairman Casey, Rep. Falella. As this bill got through both the Senate and the House, I chased down Rep. Edwards and I told him, you know, that Obama-Biden moment where they say this is a big frickin' deal? That's, you know, the harm reduction bill especially, the other bills also, but the harm reduction especially, being the first state in the nation to pass harm reduction legislation that includes supervised consumption. Be the first in the nation, that's a big frickin' deal. And it's proved so since the governor signed it, and I want to thank the governor's office for also keeping a close eye on this and supporting it. Since we signed it, we have been confirmed it's a big frickin' deal because we're contacted by the media constantly. These bills, the Telemedicine Bill, I want to thank the Office of the Health Insurance Commissioner, both the previous and the current Health Insurance Commissioner, who convened for about 3 or 4 months, several meetings to develop that bill. And then we had to go through the process of getting it through the Senate and the House and putting that input to make it something that could be passed. That bill and the harm reduction bill are Senate bills number 4 and number 16, and they had their first hearings in January. Because of the pandemic component, we prioritized bills that had a pandemic component. And number 4, telemedicine, had a significant pandemic component because people were not able to visit their physicians. They were not able to visit their therapists. And so it became critically important to make sure before executive order expired that we had this type of legislation in place. And the buprenorphine bill is equally as important because of what was found out on the streets. And we have people who experience the streets here and who we did these bills on behalf of their work, and they made it very clear to us how important all of these bills were. I also want to thank the Rhode Island Medical Society, who was a leader nationally, and Steve DeToy, who were leaders nationally in transitioning the medical society nationally from opposition to support of harm reduction legislation. It was critically important for the credibility of what we were doing. So I want to thank everybody who worked on this, especially, like I said, the people on the ground who were involved in bringing their real-life experiences to why this legislation was so important, whether you were a caseworker or a doctor. And with all of that, I want to listen and introduce Rep. J. Edwards.
Thank you, Senator Miller. And thank you, Governor McKee, for signing this needed and bold legislation. I also want to thank all of my co-sponsors and Speaker Shikarchi and Leader Blazewski for all their help in moving this bill through the House. I especially want to thank Nicole McCarty for all her help, and especially for helping us overcome the obstacles that came up during this legislation's course through the House. We might not be here today, but for her quiet persistence. She talked me off the ledge numbers of times. There was, and there continues to be, opposition to this law. We heard from the NIMBYs that they don't want those people in their neighborhoods. And even some of our colleagues have persisted in their opposition to allowing them, those people, to use a state-sanctioned facility to test and use their own drugs. Because this is going to continue the downward spiral of our state. My response is, those people, them, have names like Patrick and Elizabeth and Laurel. Those people are our families. They're our neighbors, they're our co-workers, our constituents. And this law will show that we, as Rhode Islanders, care about them. We want to keep them from dying, mostly alone, and we want to help them get better. My cousin died of an overdose. He was young, intelligent, and kind. He was taken from us too soon and too young by a disease that he did not ask for. No one asks for a debilitating and sometimes deadly disease. No one wakes up in the morning wanting to become addicted to something that will change their lives and probably change the lives of everyone around them. Today, we have something to celebrate, something to give us and all those who suffer from opioid addiction some hope. People have asked me what this bill does, and I have a very simple 5-word response. This law will save lives. When the pilot program ends and folds into a more permanent program, there will be people among us then who would otherwise not be here. Again, thank you, Governor McKee, for signing this bill into legislation, into law, and a huge thank you to all of you, nameless out there, who helped us get this bill here today. Rhode Island has much to be proud of today and much work yet to be done. And I'd like to introduce my friend and colleague, Representative Deb Filella.
Good morning, and thank you all for being here today. I also would like to thank the governor for signing these pieces of legislation today, and also for all the help that Leader Blazewski gave me on this legislation, along with the speaker. This bill creates penalties for irresponsible prescription practices, and many times addictions begin with patients being prescribed these painkillers, and they get addicted to these painkillers. Most healthcare providers take their role in preventing addiction very seriously, but there are real consequences for those few who don't. This legislation increases the maximum fine amount for those found guilty of unprofessional conduct and gives the Board of Medical Licensure and Discipline the authority to levy these fines. I have to say, the dad that I put this legislation in was very persistent, as he lost his son. And he persisted, and we continue to move forward with this, along with Representative Cardillo, with all his help as well. So I have to say, I thank you all for being here, and I really appreciate that we got this done for Ryan. Thank you.
Thank you. I'm Representative Casey, Chairman of the Health and Human Services Committee. I'd like to thank Governor McKee, Lieutenant Governor Matos, Director Wamsetta-Jones, special to see you here, and obviously Speaker Sakachi. I had a whole speech prepared and was feeling like there were certain things that needed to be addressed, and a lot of those things have been addressed by my colleagues and my distinguished colleagues in the House. I think the most important thing that I can say today is that the culmination of the work that we've done this year in the Health and Human Services Committee, both in the Senate and the House, has extreme positive impact for the people of Rhode Island with their improving their access to health care, improving the ability to treat addiction. Senator Miller and I have been working for years on trying to find a way to literally force people into substance abuse treatment. And substance abuse, and we can't always call it substance abuse. It's a disorder, this is a disease. Addiction is a disease, and we need to approach it from that respect. And when Representative Edwards brought to me the harm reduction bill, it's funny, I have a perspective of three different perspectives. I'm a state representative. I'm also a firefighter and EMT in the city of Woonsocket. And then I need to represent the people of Rhode Island. And essentially you wear three hats. And this was a very difficult piece of legislation for me because I have those three different perspectives. And it's very important to kind of sit back and look. And like I said, Representative Miller and I have been working on this type of legislation for years and really haven't had the opportunity to get very far with it, because if we were going to force people into treatment, then we were taking away their rights, and we didn't want to do that. And we don't want to limit people's rights in any particular way and force them into a situation that is uncomfortable for them. And this particular piece of legislation was an absolute opportunity to invite people to treatment. We're going to bring them to a center where they're going to have access to be able to use the drugs that they were going to use anyway. And sometimes, as we understand it, and as I see it on the street, when we respond to an addiction, an overdose, the person's usually alone. They're in someone's basement, or they're in an apartment, or they are in a place where they can go and experiment. And I believe we can't get statistics, but I believe a majority of our overdoses are first-time users, people who don't know what they're doing, who don't know exactly what they've obtained and are using. And these harm reduction centers will limit possibilities that they will have an overdose, but we will also have the wraparound services where people can be encouraged into treatment. And I think that's the most important thing. We're making a new avenue to allow people into treatment, and I couldn't be more happy. And if you saw the actual passing of the bill, I was very impassioned with my thoughts on that. This is the best way, and it's the best way that we can get people into treatment by allowing them to come to a place where they can safely do what they're going to do, and we can have a wraparound services and encourage them into treatment, help them with their substance abuse disorder, because that's what it is. Regarding the Telemedicine Act, which is a bill that I sponsored, and the entire House and Senate committee really worked hard on this, and I really need to put thanks out to all of the providers and all of the groups and the advocates that constantly called and emailed, and it's not a bother. We need to hear from you. We always need to hear from you. I need to thank the Office of the Health Insurance Commissioner, like Senator Miller did. Extremely helpful in helping us to craft this legislation so that the providers who are providing the care, the patients, and the insurance providers who are helping to pay for that care, we're all treated fairly, and we could do that in a way to create what is the ultimate goal, is more positive patient outcomes. Like I said, I think this year, I'd like to thank Speaker Sakachi for appointing me as the chair of the committee. It was an extreme amount of work. I jumped into this with both feet, and as a first line responder, I knew the healthcare system from the front lines. But to actually sit down with everybody and learn about how this healthcare system works was a great endeavor. And there are so many people that helped to educate me and helped to do that, and I want to thank them all personally. At this time, I'm going to turn it back over to the governor. I know we're going to have the ceremonial signing, and I'd just like to thank everybody for coming and everybody for their advocacy, and without all of you who are here, we could not have made all these things possible. Thank you.